Hi viewers, I am Dr. R.K. Modi from Medical Filters. Today my topic is gas in abdomen. This is a very common complaint in majority of the patients. Now, how this gas gets accumulated in the abdomen? 80% of the gas fills in the abdomen while eating, drinking. 20% of the gas is formed in the large intestine when bacteria ferment the carbohydrates such as the fibers, starch, and sugar. Now, what are the conditions when gas accumulates in the stomach? It accumulates most of the time while eating food with the mouth open, chewing, where the air enters into the stomach, while sleeping and snoring, and while swallowing foods. This is a common 80%. The gas enters into the abdomen from the oral cavity. Now, there are certain foods which can increase the gas in the stomach, like beans, lentils, vegetables such as cabbage, broccoli, cauliflower, sprouts, bran, certain dairy products containing lactose, fructose seen in fruits and used as a sweetener in soft drinks, sorbitol. It is a sugar-free product which is used in candies, gums, and artificial sweeteners. Also, certain carbonated beverages like soda and beer. So, these are the items in food which can increase the gas in the stomach. Now, the next 20% of the gas is formed in the intestine due to certain diseases. One is celiac disease, cancer of the colon, sometimes in constipation, Crohn's disease, diabetes, gastroesophageal diseases, inflammatory bowel disease, intestinal obstruction, irritable bowel syndrome, lactose intolerance, cancer of the ovaries, peptic ulcer, and ultimately ulcerative colitis. Now, what are the symptoms of excess gas in the stomach? Patient will complain of nausea, bloating of the abdomen, abdominal pain, vomiting, indigestion, stomach pain, and sometimes ulcers, burning sensation in the stomach. Now, where is commonly this pain in the stomach located? Gas, due to gas. When it collects in the left side of the colon, you can get confused with heart disease. When the gas collects in the right side of the colon, you may get confused with appendicitis or gallstones. Now, how to remove this gas? This gas is removed either by belching or by farting. Now we like to know what is the content of this gas. It consists of oxygen, carbon dioxide, nitrogen, methane, and sometimes the sulfur powder when mixes with the intestinal bacteria. It causes a purulent odor. Now, how is the gas released? Through the mouth by belching, through the rectum by flatulence. Now, who gets this intestinal gas? Certain behavioral factors like swallowing air while chewing, drinking a lot of water, or talking while eating food. All these people have got accumulation of gas in their abdomen. Certain gas forming food such as beans, potato, corn, onion, apple, high fiber products. These people have got 80% of the gas in the abdomen. The remaining 20% have certain diseases like irritable bowel, lactose intolerance, celiac disease, intestinal infections such as giardiasis, or certain medications or motility disorders like irritable bowel syndrome, scleroderma, diabetes. Now, what are the signs you get when a gas gets accumulated in the abdomen? The patient gets abdominal pain, diarrhea, fever, nausea, vomiting, bloody stool or fatty stool sometimes, and sometimes you can get unexplained weight loss. Now, how to diagnose the intestinal gas? We can do certain blood tests depending on the 20% of the intestinal disorders. To a breath test, you can test the hydrogen in your breath will show the lactose intolerance or abnormal bacterial growth in the intestine. Third, you do the screening of the colon by doing a sigmoidoscopy or a colonoscopy. And now you can do a food elimination test, such as you suspect certain foods which causes this gas. You stop those particular food and see after a week whether you get this problem. What is the treatment? You can take an enzyme called alpha galactosidase which breaks down the hard food. You can take bismuth subsalicylate, lactose enzymes, probiotics, thiamethione. How you will prevent the gas in the abdomen? By reducing the carbohydrates in your diet. While eating food, you chew slowly with your mouth closed and try not to talk while eating food. Reduce your carbonated beverages like candies, chewing gums. Drink the fluid through a straw. Reduce sugar such as fructose, sucrose, and sorbitol. Stop smoking. Thanks for watching my YouTube channel Medical Filters.